Hi, everyone, and welcome back to another edition of Public Health Career Conversations. I am joined today by Dr. Kate Rees. Kate is a public health medicine specialist who is currently in the role of a public health specialist at the Anova Health Institute in South Africa. I'm not going to go further into her bio because part of the discussion today is to unpack Kate's journey and some of the lessons she has learned as she has navigated her career. So Kate, thank you so much for joining us today and for taking the time to provide some insights through your journey for anyone that is currently contemplating a career in public health and what that may potentially mean for them.
For having me here.
It's a pleasure. So my first question really is around how did you come to decide public health? What were some of the decisions around it, and really what was the impetus to choose public health as a career?
Well, it feels like quite long ago now, so you're asking me to to dig deep. I finished medical school and internship and comm service, and I was kind of doing that thing that a lot of people do of locuming and floating around and trying to figure out what the next steps were. And I explored a couple of different things, and public health was one of them. So I knew about public health because my mother is a community health specialist. So I was more aware of the field than a lot of people are. But I wasn't totally set on it. It wasn't something that I planned all along, but it was starting to look more attractive, like as time went on. And I think, there's a lot of appeal to it. Is I'd seen firsthand like how engaging it can be as a field and how stimulating and kind of the nice career that you can have. And also, of course, the usual sense of just frustration of working in a clinic or a hospital and how intensely frustrated you can be with not being able to impact on the high level things that you see are causing all the difficulties for people. So that was really it. And then I applied for a registrar post and I got it, which I think I was lucky to apply at a time when the posts weren't quite as sought after as they are now. And I just remember starting with MPH coursework and going to, this was at UCT, going to the noon meetings and engaging with the public health department and just feeling really, really like I just really related to how they spoke and what they were saying and the topics that they thought were important. So like straight away from that time, I knew that I'd made the right decision from kind of just how validating it was that, my kind of the way that I was thinking is like a whole field, and it all, there are brilliant minds, like just saying things that I just really thought made sense. So I think I would also offer this advice to people who are considering public health is, to explore those things like public meetings or UCT noon meetings, or try and get into those spaces a little bit. I think most of the universities would be very happy to welcome people who are trying to find their feet into those kind of forums to see if it resonates with you as much as you thought it did.
Oh, great. Thank you. So I'm just going to take a step back because you mentioned community health, and I'm sure there's probably going to be somebody watching this and go, okay, now what is community health? So I think maybe we should just take a step back and just reflect that community health is really sort of the precursor to public health medicine. So for those who are watching, public health medicine wasn't always a registrar program where people did rotations. It was really an IMMED program in community health. So currently the training that we do is a fellowship in public health medicine, but then also a IMMED in community health. So a lot of the specialists that are senior to us may have an IMMED in community health and not necessarily a specialization in public health medicine, but they are part of our College of Public Health Medicine. So just to clear that up, because that's just another nuance for anybody to get confused over. So yeah, that's really, really interesting. And I love what you say about the meetings, but I'm going to hold that till the end because I do want to hear more of what you have in terms of advice for anyone pursuing this career path. But maybe can we reflect on sort of what your training looked like, and then, what happened afterwards? So what was the journey then afterwards in deciding where in the vast field of public health that you decided you wanted to work, and how this has now led you up to the role that you have at Anova?
Okay, thanks. So I studied at UCT, as I said. I did the registrar time at UCT, and when I wrote exams and finished up my reg time, I was pregnant at that time. So I was getting ready to have a baby, had a baby, finished my reg time, and then decided I didn't want to be in Cape Town anymore. So that was a big decision. That was a big factor in where I landed up straight out of reg time. So I moved to Johannesburg, where my family is, and you're going to see that my family is very important to me, because I also was looking into the NGO sector, because in some ways, largely because my mother was in the NGO sector and I'd seen it. And it was like this, I kind of thought of the public health world as you've got your academic, you've got your NGO, and you've got government. Those were the pathways that I could see. And I'd been in government for that time and really, really enjoyed it. But I'd been in the Western Cape and I didn't have connections in Gauteng, and I didn't know what it would be like in Gauteng compared to Western Cape. And I didn't want to go straight into academia. So I tried to get into the NGO sector. And I landed up applying for a job with Anova because I knew them from the Western Cape. They were a support partner in the Western Cape, and I'd interacted with them through the department. So I applied for a job as an epidemiologist at Anova, and I got that job, and I was with them for a couple of years, and then they created a new position of public health specialist that I then went into, and I've been in that role since, I think, 2018, a number of years now. So really, straight out of reg time, I joined Anova in the NPO sector, and I've been there ever since.
Great. So that's quite probably a good endorsement of Anova, that
Yeah.
you've been there. You found your niche and you've been there for quite some years. I think it would be great to hear, because even some of our clinical colleagues don't really understand what it is we do on a day-to-day basis. They're like, but what exactly does a public health medicine specialist do? So maybe you can describe a bit what your day looks like, or our days also differ. It's not we don't go to a ward round and then go and see outpatients. But yeah, what are you typically, the type of projects you're involved in, people you engage with, etc.?
Okay. So firstly, I think this is also one of those things that many people know and many people don't. So just to clarify this relationship and to explain a little bit about Anova. So Anova is a PEPFAR implementing organization. So we are funded by PEPFAR through USAID to support the Department of Health in a number of areas to provide HIV and TB services. So the work does cross over with public sector primary healthcare delivery. There's kind of crossover there. So what I do, so I manage a team. There's a couple of quantitative type background people and some qualitative. And at Anova, one of our main roles is to do project evaluations and more implementation science work and operational research. My role also, there's a lot of collaborating with other institutions like Wits University, other universities, other NGOs, different organizations that we partner with in various ways, especially in those areas. And strategy, like helping with strategy planning, a lot of when we do a lot of our grant writing, that's quite a big role, and which grants are we going to apply for and why, and then writing them as well, technical input into that. So day to day, I attend a lot of meetings. I saw this meme where they're like, the little kid is like, what am I going to be when I grow up? And the parent is like, oh, please, you're just going to sit and sit and attend meetings on your computer and read emails. I attend a lot of meetings, but a lot of what I do is related to research or evaluations intended to improve health service delivery. So we do a lot of projects that are some innovation that is being implemented often at scale. And then we'll do a project looking at how healthcare workers and clients have experienced that project, what they've been, what the challenges have been, what the barriers have been. And then there's a whole kind of process around that in terms of talking to people on the ground to design a study and operationalizing the study, overseeing the analysis, and then dissemination, including we do try and publish and disseminate our work in conferences as well. So there is that element, although we're not really a research organization. That's not our focus, but it's in the interests of disseminating the work. So that's a lot of the work is this that I do is this kind of project-based research, or more accurately, probably evaluations that I oversee. I'm trying to think if there's anything that I've left out. Of course, managing people and managing relationships and stakeholder management and all of that is a big component. And then managing the kind of permissions and things that we need as well, like the all of those kind of ethics permissions and consultations and so on.
Yeah. Great. I think firstly, thanks for giving sort of the background on ANOVA, because that will be also helpful for anyone who's curious about what the organization itself does. But it's interesting because, as I've been speaking to other colleagues, or as I reflect on my own journey, many of our roles, even though we may be sort of in policy or on the ground implementation, you still draw on quite a bit of the different aspects of public health. Like no one really goes, you may go into a niche area, but you really have to draw on such a wide range of skills, as you say, stakeholder management, understanding the health system, doing research, writing a grant. And there really is, I think it allows you to pull on different aspects of your skills and your knowledge and use those different parts of your brain. So you can, even though you may be sitting in lots of meetings a day, it doesn't get sort of monotonous in many ways.
100%. And I think, so one of the things that's interesting about my role that I really like is that I act as almost like a bridge between the people who are very programmatic and actually managing the programs and running the programs on the ground, and then the people who manage the data and look at the indicators and do the dashboards and all of that and create our reports. I can kind of engage with both of those teams and kind of bridge between them in a way that is quite rare, actually. And so that is definitely a skill specifically from public health medicine, that I've able to look at data in a very programmatic way, and I'm able to look at programs in a very interrogative way. That's not a good word, but use my public health frameworks to kind of look at what's going on the ground and through a lens of evidence and data. So yeah, that is a really important kind of part of my job.
Mm-hmm. That really resonates with me. And I think a lot of times people ask, well, what's the difference between, a public health medicine specialist or someone else who may have done public health? And what I really do find is that, as you say, we sort of are that lever between policy and implementation, or decision-making and implementation. And really, because we've trained in management spaces, but our doctors who've served in, on the ground in the services kind of understand both sides of the coin and are able to understand how, top up, bottom down, either way, decisions may impact on resources or policy, etc. So it's a really nice reflection. Thank you. So as a follow-on question, I'm gonna leave the advice for last, but I just wanted to ask, you have mentioned your mom, and she's been influential in my career as well. For those who are watching, I worked with Kate's mom, Professor Sue Goldstein, as well. But have there been any other people who, have served as mentors to you, or anything when you look back, you think, oh, that was actually quite an influential person or experience in my career?
Yeah. I think more than one person. I'll mention some of the people in particular, but the whole setup in the Western Cape was very influential for me. The way that I'm sure most people listening to this will have heard some discussion about it, but the way that the Department of Health and UCT have joint appointments, and the way that they've structured um, their work and their registrar program was very influential. It really kind of gave me, I think, that is, how I see the way that public health can be within an organization or within, so I'm not in a department, but I still follow a lot of those same functions, and a lot of the functions is probably the best word, that I saw there, and that I saw working so well and being so valued and being so useful. So I think that was really influential. The people, when I started, Prof. Leslie London was the head of the registrar program, and I mean, he's really inspiring and just a wonderful public health advocate. Virginia Zwiegenthal was my supervisor in my MMed time, and she was also really wonderful and helpful. And then the last person that I think I can mention from that time is Tracy Naledi, who was the head of the Health Impact Assessment Directorate. So she's a really awesome role model for anyone who wants to be a wonderful public health practitioner. So I think those are the people from that time. And then really the people, once I've joined Anova, have been probably less public health worlds, or less public health medicine specialists, and more people who've come into public health in different ways. So of course we have a lot of people with MPHs, and I've connected with the WITS department and other public health specialists, but I think there've also been quite a number of other people who have the public health lens, but have come into it in a different way, like with a master's in child health, or some other kind of qualification that is very public health focused.
Yeah. Yeah, I think the Western Cape is a really great model. I also had the opportunity to work with them in the past few years, and it's a really good model for how public health medicine could be integrated into the health services, and add that lens to managers or people who may not necessarily have a public health background, or have delved into sort of the public health field. Yeah, it's something that I think hopefully we can emulate across the country, provided we have enough people. So yeah, my last question to you is really around the next cadre of public health professionals. And as you said, there's many people who are in public health who are not necessarily doctors, or have come through a public health degree, but have a unique lens and have value and input into the field of public health. And I think that's a great thing about the field, is that you really can enter from many different areas. And I'm hoping to have those people as well featured to show that you could enter the field from many different ways. But if you were thinking of yourself back then, or even as you journeyed, and if you're thinking of younger professionals who are aiming for a career in public health, what is some of the advice? I know you spoke about the ComHealth and the UCT noon. Was it noon, like midday noon?
Yes.
Yeah, so maybe you can just speak a little bit more about that, and maybe any other advice that you may have for younger or emerging professionals.
Okay, cool. So just to cover that, what I was talking about before was it's just an example of like a departmental meeting where they discuss public health issues, where registrars and other interested people would attend. So I think, yeah, it gives you a window into what is important and what people are thinking and talking about. So that I feel like it's a way to just get your feet a little bit wet and hear if you are interested in this kind of world or not. But I think my experience now, having been involved a little bit in recruiting public health registrars, is that you really do need a bit more experience than what I had to get in. And so if you're getting to the point where you really think you're interested, doing a couple of short courses in the MPH that can build into an MPH, or enrolling in an MPH is a good start to getting into the registrar program. And then, of course, you really do get a chance to see if you appreciate the work or not. I mean, I think the MPH, it does give you at least a window into what the work could be like. I really, really appreciated the registrar program, and I think most people do. I think most people really feel like they got so much out of it, beyond what you learn in the MPH in terms of applied skills and kind of the comfort of working in all the different spheres and the exposure to so many different things, like you were saying, whether it's policy or management or research, all these different areas where you may not be an expert or a specialist, but you've got enough exposure that you really know what you're talking about, and can make a useful contribution. So I think if you are a medical doctor and you're interested in public health, like I think working towards a specialization is a really nice way to go. And doing the MPH would give you like quite a lot of understanding of whether that is something you want to pursue. But yeah, I really do feel that those skills that you develop are very useful in just being a professional as well.
Yeah.
What else, Satya? I'm not sure what I haven't answered.
That's perfectly fine. I think that is a question that comes up quite a bit around the MPH. I think because partly people are not able to understand, not that they're not able to, but sort of confuses the nuance between an MPH and a specialization. But we only do have very few posts, as you say. It's become quite competitive. If you look at the amount of posts we have and the amount of people who are interested in public health. And so I think universities are probably looking for people who have more of a grasp on what it actually means. And I think public health or any sort of specialty, having some sort of a postgraduate, whether it's a diploma or an MPH, gives you some lens into whether you want to do this for the rest of your life. And I think it is an important step to possibly take, so that you go into the specialization with a bit more of awareness of what it means for your career. But if you do it and you decide not to do the specialization, as you say, not all is lost. There is an awareness of the health system that you learn that would be beneficial to you in your career either way. So thank you, Kate. That is all that I have. Is there anything burning that you think, I should I should add before we close off?
No, I mean, I think, like you said, it kind of speaks for itself that I've just stayed in this role and in this organization for so long. Like, I obviously really do like my job, and I find it very fulfilling, and I enjoy. I think this career is great. So that's all I wanted to finish with.
Thank you so much. I really appreciate you taking the time, and wishing you all the best for, I don't know, the next 20 years at Anova. We'll check in with you after a couple of years again. Thanks so much, Kate. Have a lovely day.
Thank you.